I want to do an overview today so that you all understand what it is, and I want to give you some of the tools from motivational interviewing that I think you can implement immediately. In my doctoral coursework, I had to take 2 courses in motivational interviewing, and I found it to be a very, very useful not only tool, but mindset in working with students and also working with staff. It's something that you can use to dive into personal events, into private events a little bit, to get the conversation started and kind of start being able to see where you can alter that EO a little bit. So this is an overview. In order to be really proficient in this, you need to practice it. And I'll show you a sample. It was actually my baseline video that I did at the end of the presentation of a motivational interview, just example. I can't show, we had to do a lot of videotapes for review, and I did them with actual students, adolescents at Metropolitan Learning Center, and I can't share those because of consent, but I will share a contrived one that I did with my daughter, and she gave permission for me to show that. So motivational interviewing looks at, why we want to do something. And we often hear, they're just not motivated to do it, or they're poorly motivated. Well, people are always motivated for something. And, we certainly know, behaviors have functions. We understand establishing operations and abolishing operations. The real problem, conflict arises when 2 people are motivated towards different goals. The teacher may be motivated that all of their students do their homework, and the kid may not have the same motivation to do that homework, but that doesn't mean they're not motivated. They're just motivated to do something else. When the conflict arises, one sees the other as poorly motivated, and that's really not what we need to look at. In order to use motivational interviewing, just like we've talked about with everything else, the relationship between the 2 people is vitally important. So you've got to develop that relationship with the student so that you can dive into where they're coming from, that you can evoke the information that you need in order to start working on change. If the relationship isn't there, all you're going to get is resistance. And we're going to talk about the role of resistance. In order to use motivational interviewing, the person has to be willing and able to engage in verbal behavior with you. So we're not talking about using this with nonverbal students. We're talking about using this with that population that's highly verbal, that is able to share, with you where they're coming from. The level of verbal output is communicative. So we're not talking about using it with somebody who's only scripting or, not able to share what they're thinking. So what kinds of behaviors are we trying to get kids motivated to change? I mentioned doing homework. What are some other common things that we're trying to get people to change? Just throw them out. Hello?
Do homework. Do work in school.
Do work in school.
Mm-hmm. Participate in a group.
Sometimes it can just be hard for kids to separate from other peers, or to go and take a walk and take a break because they don't want to leave the room.
Yep. Putting their phones away.
Staying on the right website, staying in their own personal space.
Following directions.
To be attentive to an adult, right?
Yep. So there are lots of different things that, we're trying to get them motivated to change. How about staff? What kinds of behaviors are you trying to get staff? I'll start with just reinforcing appropriate behavior, getting them to find those good things.
Engage with kids at recess and gym class.
Talk less.
Talk less.
Put their
Follow
phones
the
down.
behavior plan.
Mm-hmm.
Put their cell phones down.
Put their cell phones down. Meet with you.
Yep.
Carve out time to meet with you. So there are lots of behaviors that we're trying to get them to change. And when change doesn't happen, it's not because of lack of information. The person that you're trying to get to stop smoking, it's not that they haven't heard that cigarettes are bad for them. I didn't know that I'd fail if I didn't turn my work in. That's usually not the case, that they don't have the information they need. Occasionally it is, but usually it's not. Laziness. Usually these are the same people that will put a lot of effort into a different behavior. And usually, often some of the rages we see or the efforts they'll go to hide the phone takes a whole lot more effort than the behavior we're asking them to do. It's usually not because of denial. It's, we hear oppositional personality. We need to stick with the cause of the behavior, not give it a name that then excuses the behavior. We need to address the actual behavior that we're seeing. So change is not hard because of those things. Change is hard because we're ambivalent. The student is ambivalent. It's an example of wanting and not wanting at the same time. I want, a little bit to do well in class, but I want a lot not to miss out on the next text that comes. So I'm not willing to put my phone down. I should answer the teacher's questions, but if I'm wrong, the kids will laugh. So I'm ambivalent. I should take the vaccine, but I've heard it might make me sick. I want to exercise more, but there's a lot of housework that needs to be done. I can talk myself out of exercise pretty fast. I want to graph the data, but I have bus duty. What are some other kinds of ambivalence that you run up against that you think students are going through? Anybody?
I'm just thinking of one student I have right now who really wants to go to a class, but his ex-girlfriend is in that class. And
perfect example. So it's not because of lack of information about the importance of being in class. So
right.
Somebody lecturing him, you really should be in class, you're going to fail if you don't go, isn't hitting what the problem is.
Right.
So
I want to finish that report, but I should check my emails too.
There you go.
A little cognitive dissonance, right? Back and forth.
Right. At the beginning of the pandemic, I was obsessed on checking the numbers on CNN, the numbers that were going up. And that was very distracting to me. I would be trying to cook dinner and then I'd remember I hadn't checked, what's happening with the pandemic numbers because it was changing so fast and, just trying to figure that out. So uncomfortable ambivalence leads to procrastination and shutting down. If we feel like we're pulled in two directions, we shut down. In order to change, somebody has to be, and you can remember it by ready, willing, and able. They have to be willing. The change has to be important to them in their circumstances. They have to be confident or able that they can make that change. So that's where the how-to is important. And they have to be ready. Change has to be a priority relative to other behaviors. So I did a study on morbidly obese teens, and this was at Metropolitan Learning Center. These were teenage girls who had BMIs that were put them in the morbidly obese range. What I found was that appearance was not important to them to lose weight because they were fearful of losing their curves. And all of these students were minority students, and where I would have thought that the motivation would have been to look thinner, it was not. There was actual fear that if they lost their lost weight, that they would lose their curves, which were in their mind highly desirable. It wasn't until using motivational interviewing that we could link health and link relatives that they had with diabetes, high blood pressure, that it became important to them. Also working on the perception of curviness, the fact that we were able to emphasize that their curves would become more defined with less weight. And once that change happened through motivational interviewing, they all lost weight. So it was exciting to see one girl lost 70 pounds and was, all of her scores showed that it remained important to her to continue to lose, and that her value of her curviness had not changed. So I know that's not an example that relates to what you're working on, but just wanted to show an example of how sometimes our perceptions are not in line with what makes them find something important. So we have to find what's important to the individual. Readiness is a relative importance. I want to do that right now. So that has to become important in context to priority for other behaviors. So that's kind of a key. So Miller and Rolnick, who devised motivational interviewing, says that constructive behavior change comes when we connect it with something of intrinsic value. So in the case I gave you, it was not with looking thinner, it was with health of relatives who had died early or who had lost legs or had strokes. That became important. People often get stuck not because they fail to appreciate the downside of their situation, but because they feel two ways about it. So motivational interviewing is an effective way of talking about the work of change, and it's a means of helping them create an establishing operation that supports changing their behavior. We discover the underlying why. So our private events, as you know, impact our choices, our experience history, the history of reinforcement for particular behaviors, perceptions of rewards and consequences, perceptions of our own ability. Example would be like need to do homework versus desire to play a video game. What we're going to talk about is the process of this choice making and how we help the individual move towards action based on a process of motivational interviewing. So I'm going to show you a couple of videotapes that sort of talk about the different processes, and then we'll go through them. Basically, it's I want to do it, I don't want to do it. The ambivalence in motivational interviewing is seen as a normal step towards change. We don't see ambivalence as being something that is a negative. It's just what we all go through. In behavior analytic terms, think of it as approach avoidance behavior. And the purpose of the motivational interviewing is helping them move towards change by working through ambivalence. And we're going to use it to get them to give their reasons why change should happen. Motivational interviewing uses a decisional balance method where we're highlighting their ambivalence, and then we're leveraging the cost. We're bringing up issues, evoking them to bring up reasons why change should happen. So this is a little video on the spirit of MI with Miller.
I'd like to back up first and talk about what Carl Rogers called the attitudes with which you, in his case, counsel, but with which you manage or lead or whatever. We call it the spirit of motivational interviewing. And in the first few years of motivational interviewing, after Steve and I published the first edition, we were sensing that we were missing something important, that people were picking up techniques and trying to use them on people, almost in a manipulative way. And human beings are highly sensitive to that. I mean, you don't get away with that, you know. And even watching it as trainers was that, no, there's something wrong here. And that's not their fault. It's something we didn't teach them. And it was this, it was the mindset or the attitude or the spirit behind it, you know. So before I talk about any technique things, I want to emphasize how important that is. It's turned up in management research. What do you assume about the people who work for you? Your assumption that they don't want to work, they're not going to work very hard unless you watch them and supervise them really closely and make them work. They'll just goof off. They won't do anything for you. And you have to punish people for not doing the right thing, and that's the way you make your company work. You know, it's not a very fun place to work in that situation, but it has to do with the mind, with the assumptions that are being made. People inherently enjoy their work and want to use their skills and want to be part of doing something exciting in life. And that an important part of leadership is to call forth people's own motivation and skills and ideas. When you believe that this person who works for me has talent and has energy and has motivation, and I want to find that, and I want to join with that, and have that become part of what we do together. You know, it's the collaborative way of doing things. And everybody, even on the assembly line, has input into how we do things because they know best how to do it. They're right there. You know, it's just a whole different way of thinking about the people who work with you. You know, and the former will lead you to be punitive and over-involved and hovering, and you know, all of that. And the latter will lead you to be calling forth people's own talents and trusting them to do a good job, and assuming that they will, you know, unless proven otherwise, that they will be doing a good job, and often getting their input into what their work is like and how we might be able to do things better here and things like that. So the attitude is really important because the techniques without it are empty. I've called it the words without the music. You know? So this is not a set of techniques to trick people into doing what you want them to do. This is a way of being with people that is collaborative and draws on your talents and their talents together and finds the right people for the right job. What we've learned, though, is that people can talk themselves into excitement about something. They can talk themselves into making a change. They can talk themselves into commitment to a cause or a purpose or a company or whatever it is. Because we hear ourselves talk. And if what I hear coming out of my own mouth is my ideas about how we could do things and my interest in our work together and my excitement about where it's going and so forth, I actually convince myself in the process. Whereas if someone is, and salespeople know this, if someone's trying to sell me something in a hard sell approach of this is what you need, my automatic reaction is no, I don't. You tend to back away from what is somebody else's excitement and idea, but be drawn into what is your own excitement and idea. And so we have particular ways of finding out, asking, inviting people to say what it is that they're enthusiastic about, what it is they're excited about. Why would you like to work here? We ask in beginning interviews and hiring interviews. And we're kind of listening for that, for the same kinds of reasons as well. Because you want intrinsic motivation, not fear to be driving what's going on, but intrinsic interest and self-direction to be guiding what's going on. Well, what change talk is then is certain kinds of speech that tend to move people in the direction of taking action or doing something. And there are a lot of different forms of change talk, and they go with different kinds of verbs. One of them is desire. Every language on the face of the earth has a way of saying, I want. I wish. There's ability language. I could do that. I'm able to do that. Yep, I think that's possible for me. The reasons language and just need statements, urgency statement. I've got to do this. I need to do this. I have to do this. I must do this. Those are the kinds of things we say that are talking ourselves in the direction of doing something, whether it's losing weight or changing jobs or whatever it is. We literally talk ourselves into it. And then there's commitment language, which is different, which is I will. When you ask someone to do something for you, you naturally listen very carefully to what they say in response, because it tells you whether it's going to happen or not, or at least how likely it is to happen. If you ask a person to do something for you and they say, well, I'm sorry, I can't, it's not going to happen, probably. If they say, I'll try, that sounds a little better, well, I think I might be able to do that for you. I'd like to do that for you. That's sounding pretty good. I'll have it for you tomorrow morning at 10. That's even stronger still. And we know that just by being human beings in society. This is just the way we work. This is nothing strange or unnatural or a new science. I mean, you know this by being a person. But we've just kind of systematized it to be able to understand what change talk really sounds like. And that when you hear it, it's really important. So in motivational interviewing, we are asking questions in ways that invite people to give us their own change talk. How would you like for things to be different? So instead of telling people what they should do, why they should do it, how important it is, how they ought to go about it, you're asking them those things. And what a difference it makes. It's not just asking smart questions. Because when we hear change talk like that, then we tend to repeat it. We tend to reflect it back in a little different form. So the person hears themselves say it first, then they hear it in a little different version that we give back to them. And then maybe a little later in the conversation, I'll begin to pull some of these things together. What we call a change talk bouquet. It's every bit of change talk is like a flower, And it's by listening, by knowing what change talk is, by listening for it, by reflecting it back, by pulling it together into little summaries in the context of a natural conversation. It's not like you're doing something. It feels like a very natural conversation. And that balance has very much to do with what you do in the conversation as well as what they do. So we now know that it's very possible to invite people to say more about why they want to do this, and to not strengthen all the arguments against change. Now, oddly enough, it's in a way the opposite of what our gut tells us to do. So that as a healthcare person, if someone comes in who's smoking, my gut wants to lecture. I want to say, look, don't you know what smoking does to people in the long run, and how much it's costing you? I mean, why are you smoking? I mean, you really need to quit smoking. That is what feels like the right thing to do, and it's not. It just isn't. In fact, it moves people in the wrong direction. Why is that is our first line of thought? I think it's the dominance thing. That you just tend to kind of charge in and try to be dominant because it feels like a good thing to be, but it has the opposite effect of what you expect. And that plays itself out in management and leadership as well. That the way in which you talk to the people who work with you has a big effect on the way in which they talk to themselves, on the way in which they talk at the water fountain, and with their fellow employees. And people are always literally talking themselves into or out of doing things. I guess I want to also say that change talk is just a piece of what we've learned. I mean, it may not even apply in many situations. The listening skills, I think, are far more generalizable. And you may need a different way of thinking about language, but you certainly know as a leader that language matters, that what people say has meaning, and your job is to try to understand what that meaning is. That's what reflective listening is all about, to make sure you've got an accurate understanding of what the person is experiencing and telling you. So I don't want to overemphasize just one piece of this. There are a variety of things that we've learned over time. And we know that the spirit matters. We know that good listening skills matter. And we know, at least in a counseling context, that adding the change talk component also helps a little more than otherwise. But this is pretty new to applications in leadership and management. And I think it's better for us to say, here are things we've learned. And what do you think? Does this feel like this would fit into your own tasks as a leader, as a manager? Because in a way, you're the person who has the best understanding of how this fits into your situation.
So he talked about, from a management point of view, MI started with addiction science and started as a method of counseling individuals with addictions, and it moved into healthcare with using MI for compliance to medication, compliance to diet, and other health applications. MI, as you know from the article, is now being looked at in terms of many different kinds of behavior change, and from a behavior analytic point of view. There's a lot of research in terms of the efficacy of MI, not a wealth of information yet in terms of pairing it with applied behavior analysis. From an ABA philosophy, we know that an inherently held value is a stronger reinforcer for behavior than one imposed from without, and that was Catania, 2006. Is it effective? More than 1,200 publications support the effectiveness of motivational interviewing. I mentioned it started in addiction science. Now we're looking at it from a behavior analytic lens. So I'm going to show you another video, except I forgot to, let me run this. Can you all hear me?
Yes.
Okay, I just want to make sure I can't see anybody, so I want to make sure I didn't lose you when I switched over.
The behavior isn't working.
This is
and then the last thing I'll just say about is summaries. Traditionally in interviewing, what we do in terms of...
This is an example of using MI in healthcare, and it's just a good example of how it works. And then we'll switch over to talking about how it can be effective in your application.
A guy goes to his doctor, and she's talking to him about smoking. And she's telling him, that he should really quit smoking, and tells him why and explains the risks of smoking. And he's like, yeah, I know. I know. And then she tells him about the patch. She tells him about all these different medicines that he can use to quit smoking. He's like, yeah, I know. She asked him if he's seen these horrible pictures in the subway of people's fingers getting cut off. And he said, yeah, I saw those. And then he leaves the office. She's really frustrated. He's really frustrated. And then he goes and he's going to pick up his son from school. So he goes to pick up his son from school, and he's driving there, and he looks down and he realizes there's no more cigarettes, right? He's out of cigarettes. It's an empty pack of Newports in there. So he looks at it, he's like, you know what I'm going to do? I'm going to go around, just drive around the block to the bodega, okay? And I'm going to buy a pack of cigarettes. So he drives by his son's school. And at the same time, it starts to rain. One of those gray New York days, it just starts to rain. He looks in his rearview mirror, and he sees that his son has just come out of school. He just missed him. He drove by him. And his son is standing in front of the school just getting drenched, right, and shivering out there in the rain. He crumples up the pack of cigarettes and never smokes again. Okay. No intervention beyond that. So I'd like you guys to think about that. Think about that story for a second as we go through our talk about thinking about motivation, what motivates people, and what's our role in that process. What I hope to do this morning is to get you familiar with motivational interviewing, this idea. What is it? Right? Hopefully when you leave today, you'll have a sense of what it is, and hopefully you'll have a sense of how you can take back a few of the ideas that we're going to talk about today in your work and talking to people about behavior change, whether that's about diabetes care, smoking, safe sex, whatever it is, whatever behavior that you're having a challenge with in terms of talking to your patients about changing it. Okay. I was asked a good question the other day about, why is this important? How is it important in terms of a discussion about communication? I think it's actually even more important when we think about how this is relevant to our work. And the things that come to mind for me are, well, first of all, just the research on what's effective in terms of getting people or inviting them into the process of doing things that are going to benefit their health. So we're going to think about how talking to people in the way of motivational interviewing may actually assist in that. Also, it's related to better clinical outcomes, this technique. The other two things more relate to us. That I don't know about you guys, but I get tremendously frustrated when people don't do the things that I know in my mind are going to be better for them in terms of their health. I really go crazy about this stuff. So it can be really frustrating. And this is a technique that helps us to work in the most effective way, and hopefully will minimize our own frustration in these situations when we're working with someone who doesn't want to change. I start most of my talks referencing an important theorist. This is at this institution, I feel like I should really come with someone who's really done a lot to change our understanding of how behavior change works. Someone who's really revolutionized the field of medicine. And I think that person is probably the chef from South Park. So what does the chef from South Park say about behavior change? How does he help us to understand, this dynamic of when we're telling people what to do and they don't listen to us? Well, he said something I think that refers a lot to it, and it's about working with adolescents. And he said, when talking to kids, look, children, this is all I'm going to say about drugs. Stay away from them. There's a time and place for everything, and it's called college. We're, in essence, telling people to do things in our practice, and then they're going out into the world and they're being told not to do them. either by their friends and family, or by other important people in their life, or by themselves. So in this process of motivational interviewing, we're trying to step out of the role of telling people what to do. Okay? We're trying to step into the role of helping them find out for themselves why they may or may not, but why they may want to do it for themselves. Okay? We're trying to have that motivation come from the inside, not impose it from the outside. A lot of the idea of motivational interviewing comes from work in other behavior change theories and was developed around the same time. Who here has heard of the stages of change theory? So the idea here in stage of change is basically two things. There's a lot of ideas behind it, but mainly we used to think about change as someone was ready or they weren't. They come to you in your practice and they have their uncontrolled blood pressure or sugars, and they come to you and you say, well, here's what the options are, and they're either ready to do it or not. But if you look at it, there's actually more of a progression in the stage change process. So here are the stages of change as posited by Prochaska and Di Clemente. So in pre-contemplation, someone throw out a problem behavior that you see in your practice, a diagnosis or an issue that you treat commonly. Obesity. So someone is morbidly obese and they come in to see you, and you say, hey, listen, I just want to give you some information about your BMI and tell you about some of the health risks. In pre-contemplation, they would say something that didn't acknowledge the risk at all, right? They may say, no need to change. Listen, I've been fine like this for my whole life. I don't need to change. My grandmother lived to be 156 like this, so I know that I'm good, okay? In contemplation, they start to talk about perhaps both sides of it, the reason to change and the reason not to change, right? There's one very common word in these phrases, and that's the word but, right? Yes, I know my BMI is high, but it's difficult to get the kind of food you're talking about in my neighborhood, okay? Preparation, someone's trying to change or trying to come up with a plan to change, but they haven't yet implemented it. I kind of want to quit smoking. Oh, you do? Yeah, I'd like to quit when my son goes to college. Well, okay, how old's your son? He's 5. So there's a preparation, but they haven't yet engaged in the behavior. In action, they're actually doing a behavior. In maintenance, they're continuing that pro-health behavior. Relapse, they go back to the initial, what we'd call problem behavior. We're really talking about our own frustrations sometime in this process. Personally, when I'm working with someone who has many health risks and they don't change, I get very frustrated. And this song helps me to get a better perspective about it. Okay, they are actually in more pain than me about this ambivalence. They're stuck in the middle and the pain is like thunder. So my first goal is to empathize with that conflict, even before I'm advising or anything. I want to understand the conflict and show them that to the best of my ability, I can empathize, show an understanding for the feelings surrounding why they don't want to do this, whatever it is, surgery, taking a medicine, whatever it is. Okay. So this is not just an academic idea, the idea of stages of change. You can apply this clinically to your work. How? In the following way. Notice here that there's an arrow between treatment and action. So we talked about obesity, right? If someone comes in and they're working on issues of losing weight, we know what to do, right? They say, hey, help me lose weight. What can I do, doc? Someone throw out, what would you suggest to them? Exercise, good. What else? Diet, okay? Some of the hallmarks of the treatment for a lot of things in primary care, okay? So that's a clear connection. Someone comes in, they're in preparation or action. Notice there's an arrow from treatment to action. Someone comes in, they know what they want to do. We tell them. The problem is when someone comes in and they're not yet ready, pre-contemplation or contemplation, and we tell them what to do. There's this sort of mismatch there. So we use this technique of motivational enhancement or motivational interviewing as a way to try to have them maybe move closer to a realizing for themselves, if they can, why they would want to make a change. Before I tell you about what motivational interviewing is, I'd like to show you a brief video about what motivational interviewing isn't.
Tell me about the problem that you wish to address.
Oh, okay. Well, I have this fear of being buried alive in a box. I start thinking about being buried alive and I begin to panic.
Has anyone ever tried to bury you alive in a box?
No, but truly thinking about it does make my life horrible. I mean, I can't go through tunnels or be in an elevator or in a house, anything boxy.
So what you're saying is you're claustrophobic.
Yes, that's it.
All right. Well, let's go, Catherine. I'm going to say 2 words to you right now. I want you to listen to them very, very carefully. Then I want you to take them out of the office with you and incorporate them into your life.
Shall I write them down?
Well, if it makes you comfortable, it's just 2 words. We find most people can remember them.
Okay.
You ready?
Yes.
Okay, here they are. Stop it!
I'm sorry.
Stop it!
Stop it.
Yes, STOP, new word, IT.
So what are you saying?
You know, it's funny. I say 2 simple words, and I cannot tell you the amount of people who say exactly the same thing you're saying. I mean, this is not Yiddish, Catherine. This is English. Stop it.
So I should just stop it.
There you go. I mean, you don't want to go through life being scared of being buried alive in a box, do you? I mean, that sounds frightening.
Yes.
Then stop it.
I can't. I mean, it's been with me since childhood.
No, we don't go there. Just stop.
So I should just stop being afraid of being buried alive in a box.
You got it. Good girl.
All right, so we get a sense of what we're not talking about here. And you know what you see there is what we talk about in sort of behavior change literature as the writing reflex. When we tell someone not to do something, there's a natural psychological process where they want to voice the other side of it, why they feel they should do it. Okay, that's sort of the natural process. We're trying to step away from that. Okay, we're trying to pull ourselves back from giving advice when it's not appropriate, when someone isn't in a preparatory stage of change. So this brings us to the idea of motivational interviewing. The definition that we talk about is a collaborative, person-centered form of guiding to elicit and motivate change. So this is like other forms of kind of client or patient-centered counseling or communication. However, it differs a little bit. And we're going to come back to the ways in which it differs here in a minute. So I'm going to take you through the principles of it, and then hopefully I'll give you some examples of how you might be able to use it in some of the settings you're in. A couple ideas here that I just like to talk about. In motivational interviewing, we focus on personal risk. Personal risk. So we talked about obesity. Someone gave me the example of obesity. What's a general population risk for obesity? Okay, so cardiac problems, all these different things. That happens to everybody. We're looking for more, what's the specific risk for the person? In other words, how does it affect their life, their self-concept, their relationships, things that are only applicable to them. We're looking for how it affects work, how it affects family, how it affects your self-concept. We find those to be more powerful generators of change. Okay. In this technique, the person takes the responsibility for changing, not us. Okay, what we take responsibility for is doing our best to try to help them to realize why they want to change. We're certainly giving advice to change, but really when it's appropriate, right? And when they've got to the stage of change of preparatory, when they're preparing to change. I'm going to talk about self-efficacy and empathy now. So expressing empathy, my wife was recently pregnant, and she would say things to me that I found it very hard to grasp. I remember one time she elbowed me in the middle of the night and said, "I have a foot in my rib." And it occurred to me, what I should say is, oh yeah, I had gas one time. And so I understand what that's like. Now, you don't know my wife, but I wouldn't be here having this opportunity to talk to you if I had said that. So what I was trying to do is get to the feeling of what she was experiencing. Okay. Now, it was tempting for me to also do some kind of, well, here, let me help you, which I did. Like, what can I do to make it better for you? But really the goal of having an empathic connection with our patients or our wives or our husbands or our significant others, partners in this setting, is really to show the person you understand how they feel, which can be very difficult because in medicine, we're predisposed to do something about it. So the first step is to show the person you understand. That must be really uncomfortable. It's so hard to be like that and have all these other things you got to do. What we find is that the more empathic we are with our patients, the better the outcomes are. From everything from clinical outcomes to not getting sued, okay? This is the kind of the power in the relationship, as people have already alluded to, okay? Now, going back to the story that we talked about the guy who quit smoking, one of the ways in which motivational interviewing differs from just a client-centered communication approach is we have a strategy. The strategy is to try to help the patient realize how their problem behavior is in conflict with an important goal or value that they have. How their problem behavior, smoking, is in conflict with important goals or values that they have, being a good father. Okay? So we're asking questions in order to elicit from them, not tell them why they need to change their behavior, but have them tell us why they believe they need to change the behavior. That's a fundamental difference. Some people refer to this approach as love with a goal. Love is just being empathic and connected, but we have a goal here, we have a strategy. We're trying to ask questions to help people tell us why they think they need to change. Not to tell people, look, you need to do this, what you're doing is all wrong. Here, let me show you why. We're trying to subtly have people, by using reflective listening and asking questions, realize for themselves that something is not right. So that's really the process of what we're trying to do here in this technique. We're trying to simply just avoid arguing with people. You know, the goal here is not to, every time I say but to a patient, I'm wondering, hey, maybe I'm arguing here. We're trying to step away from that. We know that arguing elicits more of the writing reflex, of the desire to do the opposite thing. And we're trying to simply roll with resistance. So, you know, this is thought of as sort of psychological Aikido. Rather than to fight back, we're letting that resistance go by. We're trying to find creative methods for letting that resistance go. And then lastly, supporting self-efficacy. What we find is that if a patient believes that you think they can change, they're much more likely to be able to do it. If they believe, in fact, that they could change, they're much more likely to do it. So we're trying to support the idea of themselves using affirmation that they can do it. In other words, patients come in and feel very small. And so our goal is to help them see that, in fact, there's a stronger person within. I can't tell you how many times in addictions, in diabetes, people have come in over and over and realized that, you know, despite that they're trying, they feel like they're not making a connection to the outcome. In other words, they're not making an impact. So our goal is to find something that we can reinforce to help them continue on their path. This is what we're talking about. We're trying to just not argue, not be pushy with our patients. We're trying to show them that we understand their perspective. So that's really expressing empathy. We're trying to be optimistic, supportive, and hopeful, which is supporting self-efficacy. And we're trying to help them see the conflict in their problem behavior and their important goals and values. Okay? So we're trying to help them have a discussion where they can possibly see that there's an inconsistency in the way they're behaving and their important goals or values. So what's resistance? Well, you know, frequently when I'm in the room, when I was talking to someone or when I would go in with a resident, you know, we'd often say, you know, you should exercise more. And I remember a lot of times people would say, well, talk about their pets. And so what's the one thing that you would give people advice if they needed to exercise and they had a dog? Sure. I'll walk my dog. No problem, doc. Got it covered. People find all kinds of ways to resist. If they're being told what to do, they're going to find creative ways to get out of it. Our goal is for them to come up. We know that if someone participates in the plan, if someone comes up with the plan, there is a higher likelihood that they're going to get involved in it and want to do it. So that's sort of one of our goals. Resistance is verbal or non-verbal. From this approach, from motivational interviewing, we think of it as expected and normal. If I walk in the room to talk to a teenager and they're not sucking their teeth, texting, and rolling their eyes, something is very wrong. We expect this from people. We don't walk in the room and say, oh God. We say, okay, this is what I expect, right? It's kind of the DMV approach. When I go into the DMV, right, if I expect that I'm going to be attended to punctually and courteously, I'm in big trouble. I'm in really big trouble, right? So I go in there and say, okay, this is part of the process. And you know what? Even if it's 99% them, meaning the person you're interacting with, their issue, it's still 1% me. So I'm going to use my 1%. Here's what Joan Rivers says about resistance. I don't exercise. If God wanted me to bend over, he put diamonds on the floor. We're looking for change talk. Change talk is anything that we can see in what the patient says that's in favor of change. And we're looking to just roll with it. They say diabetes doesn't exist. All right. That's a conversation I don't want to get into, honestly. Right? Try having a conversation with someone who believes HIV was created by the government. I'm rolling with that. Okay? I don't like to contradict people's beliefs. I'm trying to find the part of their belief that's in favor of change. Their speech, what they're talking about, that favors change. Okay? What important shapes or symbols do you see in this logo? The arrow. Raise your hand if you see the arrow. Between the E and the X, there's a white arrow in the negative space. So, the reason I'm showing this is because frequently in patient care, this is what happens. Someone comes in, you've been treating them for their diabetes for about a year. You're just, it's your last year in residency. You just can't wait to get out of there and get a job where you're actually paid. And you're like, all right, this annoying person, blah, blah, blah. You really like them, but they're frustrating you beyond belief, okay? What we're trying to say here is that even the person that comes in, right, who's morbidly obese, diabetes, they haven't changed in the 3 years in your residency, you're sitting there seeing them, every single person has a reason to change. It's just deeply buried, right? Maybe deeply buried through 4 or 5 residents before you, okay? So really what we're trying to do is figure out how we can get that arrow to come out through our questions. We're looking for change talk. I want to do it, I can, it's important, I should, I will. This is different from, from commitment talk, which is I will, I'm ready, and doing it now. So that's sort of indicating when someone says I want to, I don't actually just jump on it. I'm trying to get them really more to really prepare for change. But I'm really looking to elicit this change talk. Why do they want to do it? Why do they think they could do it? Why is it important to them? Not to me, but to them. Why do they think they should do it? Okay. Telling people what to do, as I said before, is kind of dangerous. It usually doesn't help us help people change. We're looking for the behavior-related issue. The arrow, right, is one idea, or the hook. What could hook them into the process of thinking about change, right? So we go back to the smoking father. It's not lung cancer, emphysema, these kind of things. It's really his relationship with his kids that's going to help him to change. Is this a good hook? My boss gave me a motivation tape. It's a recording of him firing people. Probably not. So where do we find hooks? In other words, where are the consequences in people's lives that if you talk about it with them could promote change? What kinds of things in their lives? I'd say family is the number one thing. Relationships. But there's also there's many, many other things that you can investigate. We're just trying to not stick with just the health-related consequence. So Juan's a 50-year-old unemployed man who's an aspiring artist. He's diagnosed with diabetes when he's 45, complains that he and his girlfriend are always fighting because he was diagnosed with diabetes. She's always trying to limit his diet. He tells you he's trying to cut back on eating high-fat foods, but he always starts to eat them when one of his paintings gets passed over for an art gallery. So we might stay with some of the traditional kind of general effects of this behavior about diabetes. But in this approach, we're looking for the things that are related to his personal life. How does it impact the relationship with the girlfriend? What if his diabetes is uncontrolled? How does he think it's going to affect his artwork? We're looking for the personal risks for him. So I've talked to you about the spirit of motivational interviewing a little bit, in that we're trying to collaborate with people. That's the way of being. And we're trying to elicit from them their reason for change. And the idea here is that, and when I walk into the room with anyone, what I say is sort of similar to what Bill Miller said. Look, at the end of the day, it's your choice if and how you're going to change this. I'm just here to provide you some options. At the end of the day, you're in the driver's seat. What I say to adolescents, I say, you're the boss of your life. At the end of the day, people can tell you what to do, but you're going to still choose. Okay. One of the most riveting experiences of this is when I did a training in the California maximum security prison for youth. So these are kids who violent crime before the age of 18. And they would explain to me that their daily choices, they had lots of daily choices, even being incarcerated and being in restraints. They could spit, they can bite, they can throw things at the guards. No matter where you are, you always have a choice, right? And so it's helping people to realize that it's their choice. What we're trying to do as far as the techniques, in other words, what we actually do in the room, as a way of trying to help people talk about their reasons for change and empathize with how it's difficult for them, is these 4 techniques. So is this an open-ended or a closed-ended question? Did you have more than one alcoholic beverage this week? Closed, right? It's really closed questions, a yes or no question. It's also dangerous from an assessment perspective. My doctor said only 1 glass of alcohol a day. I can live with that. So it's sort of dangerous from that perspective too. However, it's much more dangerous when we're talking to people about changing a behavior that's difficult to change. So our goal here is to ask questions that open up the discussion, okay? So here are some examples of questions you can ask in early stage change process, pre-contemplation. We're trying to have people, for them, tell us why they want to change. Here's some questions you can ask in preparation to see where the person wants to go. Okay, what do you think you should do? What's our next step around this? Okay, my belief is it's always okay to give advice. However, you know, it's more effective to give advice when the person is really on board, right? When you're really harnessing the power of your advice. So that's our goal in this technique, is to help people to get motivated to change, assess where they're at, and when they're ready to change, then we're going to start giving advice. And even in giving advice, we try to do it in a motivational interviewing way. I've got some ideas about what I think might be helpful for you. How would you feel if we talked about that a little bit? If the person says no to me, I'm very suspect of, if I did give advice, if they were going to use it or not. Okay. You know, affirmations are based on the idea of the power of positive reinforcement. People know who B.F. Skinner is? B.F. Skinner is the guy who founded sort of behaviorism. And just to give you an example of the power of positive reinforcement, he was doing a talk at Harvard to his students on behaviorism, on positive reinforcement. And they decided to play a trick on him. They decided whenever he moved to the left side of the room, they were going to nod their head and smile, just like some of you nice people are doing for me a little bit. So what happened? What happened? He lectured the entire day from the left corner of the room. The power of positive reinforcement. If you find a way to affirm your client, it doesn't even have to be about the problem behavior. It doesn't have to be about diabetes. It could be about their good parenting. It could be about the fact that they were on time. Right? We're happy to complain about when people make us late, but when people come on time, how often do we take the time to say, thanks so much for coming on time. It helps me to keep my day on track. So I really appreciate that. That was considerate of you. Okay? So we're trying to find ways to affirm them. So, you know, these are all examples of affirmations. The one I like the best here, just so you know, is the last one. It must have taken a lot of courage to come in today knowing you haven't met your weight loss goals. Okay? The idea here is that people have a BS meter, okay, about affirmations. If you just say, like, great job, people are going to be like, and adolescents are the ones who are going to catch you the most at this, certainly. I've never had an adolescent pull my card more. You know, when you say great job, they're like, oh, really? Why? So you really want to be specific about your affirmations. So I'm sick of this. I do good for a week, and then my kids start getting on my nerves, talking back and crap. So I have a few smokes, big deal. I go to these cessation meetings, I think it's helping, and then I relapse with my girlfriend, everyone comes down on me. I got into a fight with some punk that looked at me hard on the bus, got arrested, no one likes me. I can't do anything right, they're always on my case. I don't know what you all want from me, I'm just trying to get by. Patch, Nicorette gum, it's not as easy as you make it sound. So in this, we're like snowed with all this negative stuff here. But what we're trying to do is find one or two things that we could affirm, right? Something that they're doing, their attendance, their parenting, the fact that they didn't get arrested, whatever it is. We're trying to point out specific things that we saw that we think about their behavior that's good. So how do we do this? Well, one idea is reflections.
Whether they're your own, because they
Not sure what happened here. Let's see.
maybe unconsciously they had a deep discrepancy of. I felt an ecstasy that was.
Well, we lost it. I'm not sure what happened. Oh well, we'll just move on.
Yeah, he was very good too.
I know. I apologize. We'll go through the techniques that he's going to talk about more specifically. What's good? I don't know why it jumped. Again, his examples were from the healthcare field, but every one of those techniques we can use in working with our clients. And certainly, you know, you all are very tuned into looking for a positive. And I think the staff that we work with are very tuned into that writing reflex that he talked about. And we need to be models to them for trying to find those things that we can develop empathy for and that we can reinforce to have better relationships. He talked about the Transtheoretical Model. And, you know, again, the motivational interviewing is helpful in the pre-contemplation and contemplation stage, where you're looking for reasons to change. Contemplation, well, in pre-contemplation, they're not even considering change, but that's where we look for that arrow, that little piece that we can latch onto and develop. And then in contemplation, they're looking at the reasons to change and the reasons not to change. So we want to look to amplify those reasons to change. We'll talk about that. From a behavior analytic point of view, and I'm not going to belabor this because it's very well thought out in the article, but therapy looks at it in terms of being client-centered directive. We look at it from the point that we're arranging a non-punitive, non-confrontational environment intended to reduce counterpliance. And counterpliance is doing the opposite or not following rule-governed behavior. And as he gave in the example, adolescents in particular, you're guaranteed that they're going to say the opposite of what you're saying or what any adult is saying. Hayes, Strassel, and Wilson said it's directive, referring to therapists evoking and differentially reinforcing change talk. So we can look at it in terms of a differential reinforcement model, that we are looking for change talk to reinforce, and we're not choosing to reinforce sustained talk or why things should stay the way they are. We're looking for intrinsic motivation, and it can be looked at as an automatic reinforcement within the client. Motivation cannot be only influenced by, but arise from the verbal behavior of the therapist and the client. So it's a partnership, and as he mentioned, it's mainly their own conversations to themselves about change, but we are also that 1%. We're that change agent that is helping to evoke it. Exploring ambivalence is verbalizing the range of short and long-term consequences of the target behavior, coupled with a subsequent verbal commitment, which is a public self-mand in our language, to either change or not change the target behavior. So it's very much within our wheelhouse. It's just a different way of approaching. And I think it meshes very well with nonviolent crisis intervention, and it meshes very well with ACT. So as they both mentioned, we're looking at collaboration, not confrontation. We're looking at a partnership. We're looking at evocation versus education. We may give some advice, but we're trying to learn from them. We're trying to evoke from them the reasons to change and where they're coming from. There is respect and autonomy versus authority. And I think that's a particular challenge with teachers. They are used to being the authority in the classroom and telling the children what to do, where in this approach, we're looking at respecting where they're coming from and helping them make a choice to change the behavior, rather than telling them they have to change the behavior. So some skills that we use to make this happen, the how-to to all of this, using reflective listening. I know a long time ago we did a workshop on reflective listening. We can do a little more practice with that if you'd like. Developing discrepancies, helping them see that on the one hand, I want to do this, but on the other hand, I want to do this. Learning how to roll with resistance, learning how not to butt up against the student, but to roll with where they are while evoking another reason for change. And then supporting their self-efficacy, their ability to make the change. So coming in with a plan that they are a part of developing to help them see that they can make this change and how they're going to do it. So we talk about ORs as a way of remembering this. And OR starts with asking open-ended questions. Tell me about your day. Tell me what it's like trying to get homework done at night. Tell me what's going on in the classroom. Does anybody have any other examples that relate to classroom? Nope. Okay, I'll move on. Affirming. So you want to acknowledge strengths and positives you can identify. He mentioned being on time. Thank you for meeting with me. Wow, I noticed that poster that you made in the art room. That was really awesome. So just finding something that you can immediately affirm that's honest and genuine, but a positive you can identify. Using reflective listening, just reflecting back both what they're saying and how they're feeling about it. I don't have time to do my homework. I have a lot of things on my plate at home. You know, you would reflect back, you know, there's a lot going on. It's hard to do your homework. Just reflect it back. Reinforce and try to get a deeper understanding by then going back to an open question. What are some of the, or what does that look like? Or tell me how that's making you feel. And then summarizing, reinforcing motivation to change and highlighting the realizations that they've come up with. And I'll jump to that a little bit later. And you want to identify progress and themes that you're seeing.
Caroline,
Yes.
that's making me think of, I have one or two students who it's really essentially kind of that process, but they have part of their plan is, I mean, it wasn't intended for this purpose, but it functions in the same way, where they have part of their plan is to file a complaint, but the process is really exactly that, where it's just the person, the adult who's with them, writing down like exactly what they're saying and then saying it back to them to sort of make sure, and then that's used not in that moment, but later on when they meet with the social worker to, I think, follow through with the other steps so that they can, I guess, do, like the person who's with them in the moment is doing that affirmation and the summarizing and the reflective part. And then that information can be used later with somebody with some more training. But I think it's kind of a way to put those steps into action in the moment with a student.
I think too, when we reflect back, sometimes they'll say, no, that's not what I mean.
Right.
You know, and it gives them the opportunity to clarify, or they hear it and it doesn't sound right.
Right.
Which is helpful. So these are some examples of reflective listening. What I hear you saying, I get a sense that it feels as though. So again, you can reflect back exactly the words they're saying, or you may reflect back, you know, you're very frustrated, you know, so you're reflecting back the emotion that they're sending you. Here is a little.
Also, sometimes we get caught in the trap where when we try to reflect back, it's not how they're feeling, and because they may be angry or whatever it happens. No, that's not what I said. Yes, I think that's what you said. that causes that negative loop. So it comes down to no, that's not what I said. Well, okay, help me to understand better. What did you mean? You know, and how you feeling about that now?
Great.
It always. Yeah, it always requires us to do the step back and then step forward and then step back and never just to continue to step forward. Anyway.
And it keeps us from talking too much. You know, it gets us listening instead of talking.
Reflective listening is the ability to bounce back at them what they're saying. This is a skill that doesn't come naturally to us. When involved in a conversation, we tend to talk about ourselves or give advice. We
Oh no.
try to make them feel better or agree or disagree or tell stories. In order to be a good reflective listener, we need to set aside our own wants briefly and work to make sure that your person gets your attention, your empathy, and that you show them that you understand what they're saying. Reflective listening helps people know if you're understanding them, and at its best, it can help them clarify their thinking, helps them understand what's underneath those thoughts and emotions, and help them find solutions on their own. So it's basically a magical thing. I spent a year learning this skill in grad school, and I've spent the next 7 years reminding myself to use it. It is my most powerful therapeutic tool, but it's so simple that most people can learn the basics and begin to practice it on their own. The simplest level of reflective listening is to simply show them that you understand them by summarizing what they say and asking them if you got it right. If you try to do this without a relationship, then this can sound really patronizing and condescending. So make sure to be sincere. Basically, you take what they said and you put it into your own words with a question mark at the end. So let's use an example of a teen who really wants to go to a concert with his friends. He might say, "Mom, all my friends are going to this concert. Ariana Grande is the best singer ever. And the opening band is awesome. And I've saved up all the money and I just have to go. You are so unfair." So staying on the content level, you might say something like, "You really want to go to the concert tonight." This may seem so basic, so obvious, that we often just skip over it. But remember, good listening isn't just about understanding, it's about showing them that you understand. And making little reflective statements like this can go a long way to help the other person feel understood. It doesn't do you or them any good if you understand them, but they don't know it. Hearing it back can be a good part of the healing process for some people. You can also use this if you're unsure exactly what they mean. For example, you could say, "Let me see if I'm getting this straight. You're angry with your sister because she borrowed your astronomy books without asking?" It's also important to ask if you got it right. For example, I was recently in a session with a couple, and the woman was explaining how it made her feel shut down and upset when her husband always tried to solve her emotions instead of listening to her. While talking with the husband about empathic listening, he seemed frustrated about her not accepting his quick advice. I threw out a guess. "So when she doesn't accept your advice, you feel rejected?" He took a moment, paused, and then clarified. "No, it's not that," he said. "I can handle my solutions being rejected or even me personally being rejected. It's that I just love fixing things. It's part of who I am." So I tried again. "So you feel a little lost, like unsure of what to do if you can't be a fixer?" He replied, "Exactly. Like, what is my role? I want to be doing some good. And if I can't fix anything, I feel like there's no point." After I understood him and he knew I understood him, I was able to address his real concern by explaining that just listening to and validating emotions can actually be more helpful. And it genuinely does some good. And because he knew that I understood him, he accepted me and my advice.
Still working at home? Then you need to have video conference lighting. I've been working from home for about a year.
This is basically staying on the content level. The next level is to use reflecting to help them clarify their thoughts and make it more concrete. So when people understand why they're feeling or thinking that way, then there's greater potential to find solutions or acceptance. When this is done from a "I will fix you" attitude, this will feel like judgment. So don't try to diagnose them or be their therapist. Be sincere, be humble, be curious, and ask questions to clarify, but not to guide the conversation. So this is the emotion level, helping them understand their emotions. So back to the concert example, you could say something like, "You're upset that I don't trust you," or "You probably feel annoyed that I don't get you," or "You're feeling sad and angry that you can't do something really important to you." Now, at this point, you may be wondering, why am I making these statements instead of just asking the question, "Are you feeling angry?" Well, here's why. With good listening, statements are often better than questions because, number one, questions are about your agenda and not theirs. Questions make it so that you are now directing the conversation in the direction you want it to go instead of being the listener who is trying to understand. You become the person deciding where the conversation should go. You may hear what you want to hear, but they may not be able to say what they're trying to say. This discourages the other from speaking their mind. Number two, questions often make the other person feel interrogated or on the defensive, and this leads them to being less open. Now, I'm not saying you should never ask questions, but in general, people ask too many questions under the guise of listening. Try to catch yourself, let go of your agenda, and use more reflective statements. Pay close attention, and you'll see that it will invite more openness. At its very best, reflective listening helps the speaker express and understand concepts that are at the leading edge of their comprehension, meaning that they don't really understand them yet, but by talking about them and expressing them, they'll learn things about themselves and their emotions that they didn't know before the conversation. So this is the meaning level, helping them express what all this means to them. So when we bounce back something at the meaning level, we might be saying something like, "You're afraid that I'm saying that you're a bad person, or you're not good enough to go to that concert. You really want to be trustworthy, but it hurts to think that I don't believe in your abilities. You're frustrated that you don't have complete freedom in your life yet. And I bet it's really annoying to you to have rules that you don't agree with. Maybe this makes you feel like you don't have power over your own life." Or here's another example. "I'm pretty sure Marco loves me, but he doesn't put effort into big celebrations like my birthday or our anniversary. So you're feeling unappreciated and you wish for Marco to be more thoughtful and chivalrous?" Exactly. "For example, for my birthday last month, ... And Amelia continues expressing herself. We don't need to go to the deepest level every time. When we use reflective listening, we can address content, feelings, meanings, and sum things up. Here's some examples of how that would sound. So from your point of view, it sounds like you're feeling, you believe, it seems like, what I guess you're feeling is, it might be that you..." Some measure of guessing, like making these tentative statements, can be helpful. You're not trying to be a therapist, but rather to help yourself and them better understand. Also, don't diagnose, solve, judge, or argue. Don't tell the other person their motives or analyze them. Your goal is not to figure them out, but to get on the same page with them. Show them that you understand by summarizing, asking to clarify, and looking for deeper meaning. This video is an excerpt from my intensive course on how to help when someone you care.
Little ad.
Caroline, I think that's like the whole time that I was watching that video and thinking about this reflective listening, it makes me think of how valuable it is as a de-escalation tool too. And I think that, at least in my experience, I see a lot of staff that just jump right into problem solving with the kid or trying to fix the issue, when really the student just needs to be validated and listened to, and it's about what their perspective is in the moment. And I think, I mean, I've observed it a lot where it's, well, that's not what happened, or they didn't say that, or they weren't even talking about you. And it doesn't matter what the actual reality of the situation is. It's working with the student's perspective. And especially when they're escalated and heightened, you're not in a problem solving mode. You're in a de-escalation mode, so that you can get to that problem solving point. And I think sometimes people try to put the cart before the horse.
Absolutely. You know, I think it, you know, what it comes down to, you know, it's effort, you know, and we also, on the flip side, it's effort to be more reinforcing prior to that. And if people aren't on a schedule of some kind of reinforcement, it's lacking. The idea of like, let's quickly resolve this is, well, that's going to get this problem solved quicker, when in fact, that's not the right tact. The first thing is to stabilize as opposed to fix it and move on. Yeah, no, it's very, it's, I like it better than the Ross Greeny kind of language. It's active listening for sure.
Absolutely. And they're really,
It also being like sort of part of the student interview for a functional assessment.
absolutely.
Where you're, kind of gathering information and just doing a lot of the affirmation piece.
Yeah. I like to call that sometimes the shut up and listen up. Where you just stop talking, open your ears, and reflect it back to them.
I think that was Bugs Bunny. Shut up, shutting up.
And then we have the chef from South Park and Bugs Bunny leading us. So this is just a list of roadblocks to listening, and I know we encounter these in schools all the time. Moralizing, shaming, ridiculing, warning, threatening, persuading with logic, lecturing. I think we also run up against this writing reflex. This effort to, you got to set them straight. You got to tell them, you're not going to graduate unless you do that. To show up in class. And what happens is they respond to that with the opposite of what we want, because they haven't been understood. And some of the researchers talk about thinking of the writing reflex as if we're on a slippery road and it feels right that we want to turn the wheel of the car and we want to write it. But what happens is that will make us skid off the road. What we're told to do is to kind of turn into the skid on an icy road versus away from the skid. And if we turn into the skid, we can then, gradually correct. It feels right that we want to fix it, and counterintuitive to kind of rolling with them. But when we roll with them, we're able to kind of turn that skid later on. So I think that's a good analogy, at least for me, to remember. What they say is just the tip of the iceberg, and we can do a simple reflection, just reflecting the words back to them, or we can do a complex reflection where we reflect the words and the emotion. If a student said, I didn't want to do it, I was busy texting with my friends, you could say you didn't feel like doing your homework. A complex emotion might be you didn't feel like doing your homework last night. You didn't want to miss out being with your friends. So, giving a little more information with it. Summarizing, you want to understand what they're thinking and feeling and send it back to them. You don't want questions, you just want reflections. You want to convey empathy and understanding that you're seeing the world through their eyes. So I talked about the differential reinforcement of change talk. You want to listen for that arrow in the FedEx. You want to listen for those little indicators. And we can remember that by the word darn. And I'll talk about those little indicators. We want to evoke those versus telling them what to do. So we want to evoke more change talk and less sustained talk. Sustained talk is why I should just keep doing what I'm doing. We want to develop discrepancy. So the difference between the present state and what they really may desire as a long-term goal. So we've got to get into those values. And I know ACT talks a lot about evoking values. We want to shift the conversation when there's little or no change talk to start evoking the difference between, how things are now and how they'd really like for them to be. We can confront them with their own values and invite them to talk about them in a way that helps them see the difference between the current and the desired. And, kind of like when the guy looked in the mirror and he saw his son standing in the rain, he was immediately confronted just visually with the difference between his current behavior, and his desire to be a good dad. So this is called a decisional balance exercise. And you want to help them understand, on the one hand, there are advantages to doing what they want to do. They can say they're skipping class, they can hang out with their friends, they can check their phone. On the other hand, won't get to see a girl I like in class. I lose my phone. I might get grounded if I get caught. If I go to class, well, maybe I can graduate on time. I get to see the girl. My parents won't be mad. The con to going to class is, gosh, it's boring. I don't want to be there. So you start evoking, this information from them so that you can get them into a decisional balance. And in doing a summary, you throw that out with, on the one hand, this happens. On the other hand, this happens. So you're highlighting the discrepancy. And really, you're helping them weigh rewards and punishers versus punishers. So I mentioned the darn, and they actually use darn cat. For those, well, nobody, you all probably don't remember, there was a Disney movie a long time ago called That Darn Cat. So I can remember darn cat, but the cat part talks about commitment to change. The darn part talks about the ability to recognize change talk. The D is the desire. I wish I could. I want to. Statements about preference for change. When you hear those D words, the desire words, that gives you an opportunity to reflect those back. You really want to. You really wish you could sit through the whole class. Ability. Statements about self-capability. I know how to do it. I feel like I could probably do that. Are all statements of ability that you want to reinforce. Anytime they come up with statements of reasons for arguments for change, you need to jump on those. I know it's better for my health if I don't eat ho-hos during class, or I know that my grades would be better if I did my homework. And then need. Need statements are about obligation to change. I really need to do this so I can graduate. I really need to do this for my mom to be happy. Jump on those as well. And then any statements about commitment or action all show readiness to change. So I will, I'll try to, are all statements that show that they're in that stage when you can put an action plan in place. Until you get there, it's not going to help to have a plan. So rolling with resistance is going with the skid. Anytime you butt up against resistance, it's a signal you need to double back and go back to supporting them, listening to them, working on trying to get more change statements. How you respond to resistance either strengthens or weakens it. If you pay attention to it and you butt up against it or you argue with it, you're strengthening it because you're giving it attention. When you respond to resistance with non-resistance and just reflect it back, then you're helping them move into more change talk. When you're getting resistance, you can use amplified or double-sided reflections. Double-sided goes back to that discrepancy. On the one hand, you know that you would feel better if you went to bed before midnight. On the other hand, your friends are all gaming at that time and you want to be with them. And I just did that backwards because you always want to end with the behavior you want them to do. So on the one hand, your friends are all online. On the other hand, you know you would feel better and make it to class if you went to bed on time. And amplified reflection is taking what they say and amplifying it in a way that exaggerates it. On the one hand, you wish you could be with your friends at night. On the other hand, if you don't go to class, you're not going to graduate on time. Or if you spend time with your friends, you're never going to get your grades up. You're amplifying what they've already said. They're expressing concern about where they are in school, and you're amplifying that. So you're trying to amplify to reduce that counterpliance and explore a little further. Sometimes they'll argue with you and you'll have to take back a step. But it can be very helpful. Let's see. So in building motivation, you want to look at their values, how important it is, the level of confidence, and how ready they are. So what stands in the way of making the changes they might want to make, and how to increase the chance. And there's some really effective ways of boosting the level of importance and the level of confidence. And this is my really favorite part, and where I've found the most success in motivational interviewing. And what I do is I use a readiness ruler, and I just have a piece of paper with 0 to 10 on it. And I talk to them about how important is this to you? So let's say it's homework. You're going to do importance and confidence separately. So how important is it to you to do your homework? On a scale of 1 to 10, with 0 being not important at all and 10 being very important. Now, I've done all of the work already where I've gotten them to give me some reasons for change. So let's say they say, well, it's only a 3. I don't think I should do it. And what I would respond with is, the 3, that's great. That's 30% there. Tell me why it's a 3 and not a 2. Okay, so I'm jumping on the fact that they didn't give it the lowest score, hopefully, because I've done some work getting them to give me some reasons. And I'm trying to get them now to give me more reasons. Well, it's not a 3, it's not a 2 because I know, my mom would be really mad at me, or I know my teacher, isn't going to ever give me a chance, or I'll never graduate. You want to get them giving you those reasons. So what made you answer with maybe not a 0 if they're giving you a 1. You want to find that little arrow, find that place you can jump in. And then what would it take for you to move from a 3 to a 4? Just a slightly higher number. We're not looking for perfection. We're looking at, what would it take? Would it, well, it might be, if I only had to do half as much homework, or, you're getting them to generate some reasons. So you're trying to move them over this change talk hill from pre-contemplation to contemplation, and then moving towards change with preparation and action. I use that ruler for readiness, importance, and ability, because I want to see how ready are they to make a change. They may think it's important and they may feel like they're able, but then they may tell me, but I'm not going to do it right now. I'm not ready. If they're not ready, I've got to work on moving them towards more readiness.
Is this I just had this conversation in a PPT. This is where maybe non-contingent reinforcement might help change an EO-MO to readiness, instead of making it an earned contingent thing.
Right.
Like change the mood, change the orientation.
Well, and, again, building that relationship, it all hinges on having a relationship and feeling heard. So if that piece isn't there, it's going to be very difficult. And then you want to consolidate commitment. You want to, have them recognize the disadvantages of the way things are now, the advantages of change, have some optimism about change. And that optimism comes from that ability ruler. So when they're saying, well, I feel I'm a 7, well, that's great. You're showing a great ability to do this. You want to reinforce that. The intention to change, that's the readiness and the confidence. And then they make a commitment. You're looking for words like I hope to, I plan to, I'll try to. In the example that he gave in the video, on Monday, I will do this. I mean, that's super. I mean, that's a real commitment. But we want to reinforce approaches to commitment as well. And then that's when we can put a change plan in place where we develop specific strategies. We want them to come up with as many of those as possible. And that's what really differs from kind of where we are now. We want to use their ideas and guide them to how they might get there and kind of jointly go where they want to go. I will often use the idea of hitting a target from a distance to talk about steps. I'll say, and I'll show you in the video that I did, here is graduation. And where would you say you are right now in being ready? And they might put it in the outer, well, what could we do to get one step in? So, getting an idea of where they see themselves relative to their overall goal, how we could start making steps to get to that goal, and then create the SMART plan, which you all know how to make SMART goals. So I have an example of a semi-contrived session. It was a contrived session, but it was about a real behavior that my daughter had, a problem about going to bed at night and just getting enough sleep. I did this as actually a baseline in motivational interviewing for a class. So it's not a perfect example. There's some closed-in questions versus opened-in questions, but I think it'll give you the idea of the spirit of this. It's several years old, but let's see. It'll give you an idea of how a whole session would look. Oh, come on. Here we go. 2016. And my daughter did give permission. Just scoot it to I'll skip the intro.
All right. Okay. Can you tell me a little bit about your problems with sleep? I have trouble falling asleep and staying asleep at night. I've also been having trouble waking up in the morning and usually have headaches during most of the day.
Oh, that's tough. So your sleep problems at night are affecting your next day with headaches. How long has this been a problem?
A couple of years.
That's a long time to be suffering from lack of sleep and headaches. Has it stayed the same or has it gotten better or worse over those years?
Oh, gosh.
It seems like it's getting worse.
It's getting worse. Is the problem the same every night or are there some nights of the week that are better?
I haven't been able to tell if there's an actual difference.
Okay. What about when you're on vacation? How does sleep go when you're on vacation?
I do have some of the same difficulties, but when it comes to vacation, and usually vacations are to relax and have fun, and so I do tend to try harder to get up during vacations.
Is there anything that you've tried that has helped you with your sleep?
Nothing really.
No? If I was to ask you on a scale of 1 to 10, with 1 being not a problem in your life at all and 10 being the worst thing that can happen, where would you see this problem with sleep in your life?
An 8.
An 8. Okay. Can you tell me how it's affecting your life?
And tell me a little bit about your bedtime routine.
I usually have difficulties with sleep because I'm so exhausted and then I can't really do what I want to do. So what I've been doing at night to sort of calm my mind, I guess you could say, part of the difficulties of falling asleep is that my mind is just really busy and thoughts race. So what I've been doing is I usually read a book until I fall asleep. And also, if I wake up during the night, I'll just continue to read some more until I fall back asleep.
Okay, well, reading is a good strategy, but it sounds like the reading isn't quite calming your mind enough. So what you're telling me is it's hard for you to go to sleep, and then it's hard for you to get back to sleep if you wake up during the night.
Yes, and then I also have problems waking up the next day because of that.
Okay, you've tried reading. Is there anything else that you've tried to help you sleep?
No.
Tell me, you mentioned that you have a hard time waking up in the mornings. Tell me about your mornings.
I usually end up sleeping until 12 or 1 in the afternoon, and I have really bad headaches after I wake up for the rest of the day.
Can you tell me a little bit more about your mornings?
I usually feel completely exhausted, and because of that, as well as the headaches, I am unable to accomplish what I want to during the day.
Okay, so what kinds of things would you like to accomplish during the day?
Well, I'd like to ultimately get a job and move out and have my own life and hang out with friends and be able to participate.
So very, very typical goals. Who do you live with now, Emily?
My parents.
And are they supportive of you?
They're supportive, but they tend to really annoy me about getting up. I really want to live in an apartment, but I'm afraid that if I do, at this point, I'll mostly sleep most of the time.
Tell me why the sleep has affected you in getting a job.
Well, right now, I'm just not as motivated as I want to be. I really kind of don't want to start a job and then fail at it or have to give it up because I'm not working to not accomplishing as much as I want to because I'm so exhausted. I'm not working at a level that's necessary for the job because I'm so exhausted.
Sounds like the combination of the lack of sleep and your anxiety are keeping you from even attempting to start a job. Tell me, what would you want to do if you didn't have this problem?
Well, I would definitely like to get out more and have fun with friends and to have a job and to get back to doing more of the physical activities I enjoyed when I was younger. I really enjoyed hiking and stuff like canoeing and kayaking and fishing, and back in high school I got really into geocaching, so that was kind of fun.
You're a real outdoor girl.
At heart, yes.
At heart. What do you like to do for fun other than those things?
Well, that's more of indoor activities. I really like to read, to watch movies. I enjoy going to the movies. I enjoy going to some different kinds of concerts, and I really enjoy playing with my dog.
How are you able to connect with your friends?
I'm not right now, really.
Why is that?
Well, they've all kind of are busy with their own lives, and a lot of my friends are not even in the state anymore. They've moved away. So the friends that I do have that are so busy with their own lives, usually the times that they are able to get together, I'm really not feeling up to it because I'm so exhausted.
So you're feeling tired, and it sounds like you might be feeling a little isolated too.
Yes.
How's your general health, Emily? Or do you exercise? Do you eat well?
Right now my general health is pretty good. It always could be better. And I only exercise a little right now, such as going for walks and maybe doing an exercise video at home.
Those are good forms of exercise for you.
My eating habits right now are pretty good. I only have really one guilty pleasure, which is chocolate. So
I think many of us share that guilty pleasure. Here's a hard question. Do you think sleeping so much into the day allows you to escape unpleasant things or feelings?
Yes, it usually helps me to stop myself from worrying or becoming so anxious that I become overwhelmed, or even having to feel the pain that's caused by my headaches.
Okay, it sounds like, Emily, on the one hand, the sleep helps you not be so anxious. But on the other hand, your sleep problem is keeping you from meeting a lot of your goals, from having a job, from having friends, from doing fun things in your life. Is that true?
Yes.
Okay. Take a look at this. This is a ruler. And this time, 1 is not motivated at all, and 10 is extremely motivated. How motivated do you feel today in trying to change your sleep habits?
8.
An 8. Okay, that's good. That's 80% there. Can you tell me why you chose an 8 and not a 5 or a 6?
I feel like a 5 or a 6 won't get me where I want to be.
And you feel that you're confident? If I ask you the same question with the same ruler, how confident are you that we can make a change in your sleep from 1 to 10?
Probably 7 or an 8.
A 7 or an 8. So you're pretty confident too. Good, good. Well, we're going to be trying to generate some ideas together and how you might reach that. We're going to do one more exercise. This is a target, like when you're doing archery, and you want to hit the bullseye. In this archery exercise, the bullseye is where the values you've talked about come from. What are some values that you would want to see in the middle of the target, right on the bullseye?
I'd like to participate in the world and to get out more and meet with friends and do fun activities.
Okay. Emily, tell me, where do you see the problem with the sleep putting you right now on this target? Where would it be?
Pretty far away from it, probably in the furthest ring.
Okay, so we've got some steps to take. It's not going to be an overnight change, is it?
No.
But we can move towards that goal. Can you think of one small step that could get you just a little bit closer to that goal?
Maybe get up even if I'm tired.
Oh, that's a great step. Can you be a little more specific though, so that we have a way to measure it?
Maybe making sure that I get up by 7 o'clock in the morning.
Okay. That's a great goal, and I don't know if you know this, but research has shown that getting up at the same time every day is helpful for sleep at night. It helps reset your nighttime clock as far as falling asleep. So even though you may be initially even more tired than you are now, by getting up at 7, you will find it easier to go to sleep at night. So the goal that you came up with of getting up at the same time and getting up at 7 every morning is a great one for helping your sleep on both ends, falling asleep and on getting up as well. All right. So your goal could be, we're going to write this down, and I'll give you this to take home. I will wake up at 7 o'clock each day, even if I'm tired or lost sleep the night before. Is that right?
Yes.
Okay. Okay, you're on the right track. Can you think of anything that you could do to make that happen? More likely to happen?
I could set my alarm and put it across the room.
That's a great one. I'm going to write that down too. Set my alarm and put it across the room. Okay, that's great. I have some information for you, Emily. Talks about some other steps you could take to improve your sleep. It's a little brochure about what they call sleep.
Okay. The brochure part was being a part of a behavioral health program as if you were in a clinical setting, which is not the case in a school or in a home setting. that was a contrived situation with her. She knew we were filming it. We did not prep any of the answers. It was a real problem, and she really did generate the reasons. She generated the ideas and the goals. And I'm happy to say she goes to work every day. She gets up on her own. She sets an alarm. So great improvement. There was information sharing at the end about research and regular bedtimes that related back to her goal. So, it was a little more instructive than, you're probably going to want to be, but if they're pretty motivated and they're generating the goals, then, you can talk about graduation credits or talk about, more instructive information. So was that helpful to see the session? Anybody have any thoughts on how they might use it?
Well, definitely part of an FBA.
I have a student who's struggling with getting to school on time. I could see this helping him.
Maybe as a post autopsy, off of a prob behavior and kind of like work it from another angle.
I could see with these kids who are super verbal too, just part of like including them in the process of shaping their own behavior. So deciding whatever the next step would be.
What I found when I've
Problem
used
solving too. I mean, from their perspective.
When I've used it for work, what I've found is surprise. The information that they give is not what I expect. I mentioned the girls with the curviness. That would be a barrier that I had not thought of. And if they had not generated that and it was consistent among the girls, I would not have known that concern was a barrier, that they were going to lose their curves to make them less attractive because I had my lens on.
At times, sometimes just sitting at a team meeting when we're discussing a problem or issue with a kid, the staff sitting there are wanting to fix everything all the time based on what they see as best practice. And instead just to say, what does the child want? And what are they willing to do? Well, they're willing to arrive to school for 9 o'clock. So I'll tell you what, let's change your hours because that's what they've said they're willing to do instead of that 7:30 or 7 o'clock time.
Mm-hmm.
I'm wondering what people's thoughts are if we are planning on utilizing some aspects of this approach with a student, but they're already seeing a social worker or an adjustment counselor, and you want to be respectful of their practice, and you don't necessarily want to. You want to be respectful of their space. Just like if a social worker came up to me and said, "Oh, I wrote this behavior plan for a kid that I already had a behavior plan for." I wonder what people's thoughts are about being respectful of their approaches as well.
I'm not suggesting that we use this for counseling for talking about trauma or any of those issues. I'm suggesting we use it to talk about the same behavior change that we're already expected to be using it for.
I hear your issue, Darren, as well, because sometimes somebody will come forward and say, here, I have a behavior support plan and that I want to start right away. And you're looking at it and say, not too good. But in contrast, if we were to create something and then provided it teaming and to say any kind of adjustment, if this is just a draft, anybody want to help us out with it? If anybody's got input, we can 86 the whole thing, or we could take parts of it. What works? Mm-hmm. And this way it's open to the team at large.
I think it's sort of case by case. Like I know I have some students who I would talk to the social worker who sees them and say, here, can you roll this? Can you have this conversation with them? And this is what we're looking to do. And others who I think it would just naturally, we would be the people who have that.
Sure.
It seems like it came right out of the administrative toolbox for disgruntled employees too. It could be used for, it's a good tool across the board.
It is. You know, I was going to ask, how do you see using it with staff?
Right.
Same.
I use the reflective talking with them all the time. Like, oh, so it sounds like this is a really difficult situation for you. That, oh yeah, that stuff. Yeah, all the time.
Seems like you're underappreciated.
That you don't have a lot of time.
I think getting an idea of readiness, you know, how ready do you feel? You know, how able do you feel? Just using that ruler might change our training. If I found somebody felt they were only at a 2 in their ability, then I haven't done my job in training them how to do it. You know, it sounds like it might help for me to do some more modeling. You know, if you're at a 2 on running programs consistently, I need to do something else. Any other thoughts about applications with staff or students?
Maybe with parents.
Yeah.
Great comment.
Mm-hmm.
Definitely.
I think sometimes, we don't realize in the hierarchy of things that are important in their lives, helping with homework may be at the bottom because they just have overwhelming demands. So setting a plan in place that assumes they've got open time.
As you said that, can I share an example, Caroline?
Yeah.
So as Susan said, the parent thing, I'm like, oh, I was just with the social worker having a conversation with a parent last week. She's got, this is a middle school kid, and really like homicidal threats to his mother at home, and some aggressive behavior towards her. And we had talked with her about utilizing 911, and knew that she was hesitant to do it. And we had sort of just innately attributed that to this standing history of this kind of behavior, and her tolerance really being much higher, her threshold, for those things being higher. And then after we were sort of talking to her and saying, like, where are you? How comfortable are you with this? She finally was able to identify that she was not comfortable because she was worried about the police shooting him, and not understanding what to do when they came into the house and how to respond to him. And that totally changed what we were gonna, how we wanted to respond to that, because she said in the past she'd called one time and they yanked him out of the house and it broke the banister and all sorts of stuff. And that with all this stuff in the news, she just was very worried about that. And after hearing that, we understood exactly why she wasn't gonna call. So it was very helpful asking those questions.
It wasn't just a worry on the part of the mom, but it was actually experiential, right? There you go. She had that. Yeah, that's powerful.
But I think that's, to your point, the surprise of that. I was not expecting that to be her reason for the hesitation at all. But
no. And with all the current media attention, about that issue, it's even more understandable.
Mm-hmm.
Wow, that's a great example.
Mm-hmm.
Anybody else have questions or comments or thoughts? Okay, I hope that was informative.